As part of her commitment to heart health education, Dr. Nitza Alvarez led a discussion on the importance of lifestyle choices on cardiovascular health in February in observance of American Heart Month. The Go Red for Women Breakfast in Red at the Harbor Hills Country Club in Lady Lake provided an opportunity to speak candidly about the special circumstances surrounding women and heart disease.
Women present with very different symptoms when they have cardiovascular disease, especially when it comes to coronary artery disease. They might not present with the typical symptoms of having chest pain. A woman can present just complaining of feeling fatigue or short of breath. And many times they had to be visiting different providers with the same complaints before it's identified that they had cardiovascular problems. It wasn't until 2 years ago that the American Heart Association finally released a statement about how female patients are underdiagnosed and undertreated. So we know that now creating the awareness of how is that different, and unfortunately the major threat is us, it's ourselves. We don't seek attention on time. We delay. We always caring for others and then leave ourselves for the last minute. But at the same time, we are the decision makers. We're there in front of the family, and we are the one that had to care for ourselves, be able to identify those symptoms, seek attention so you can continue providing that care for your family. It's important because cardiovascular disease, unfortunately, is still the #1 killer in women, and a lot of our women in America don't know that that's their major life threat. So we invite them here to come, and not only for them to acquire that knowledge, but also to be our spokesperson outside in the community and create that awareness among their family members as well. There's a lot of risk factors that are modifiable. High blood pressure is manageable, weight loss and diet, exercise, cholesterol. You can manage the cholesterol. You can manage the sedentary life. Smoking is another risk factor for cardiovascular disease, so smoking cessation, management of diabetes. Actually, there's only few risk factors that we cannot modify. The majority of the risk factors for cardiovascular disease are modifiable, and if you can take control of that, then you can take control of your life.
You'll find a link to information on this story when you click the News of Note tab on our homepage at yourhometownhealth.com.